guys, it's me, Tracy, here at Lakefront Family Dentistry, office of Dr. Hauser and Dr. Kanter. And I'm here today with our amazing Miss Sandy. She's one of our hygienists here today. And we have a few questions that people have asked regarding periodontal disease. So we're going to ask her a few questions so she can give us her expertise. So let's go ahead and get started. Miss Sandy, hello.
Hello.
So our first question of the day is, what is periodontal disease and what is gingivitis? And what is the difference?
So I'll start off with gingivitis. Gingivitis is where you have red inflamed gum tissue. It bleeds easy. You can usually visually see the inflammation in the gum tissue. It is reversible, so that is very important to know. So if you see that, we can reverse it back to healthy, tight gum tissue. Periodontal disease is different because it is not reversible. Once you have this condition, you have it for life. So that is going to be all maintaining once we get everything cleaned up from there. So just like gingivitis, you're going to notice that inflamed, red, swollen gum tissue that bleeds easy. It's a problem because that is all the bacteria in your mouth creating an infection, and we need to clean all of that out. Once all that bacteria is in there, it starts breaking down the bone, and so once you lose your bone, that's what's holding your teeth in. So this is a picture of advanced periodontitis. It's easier for me to show you this way because you can see it a little bit more clear. But right here there is recession of the gum tissue. So you've lost attachment. It's actually pulled away from the tooth structure, and you've lost bone in here too. So you can see all this stuff around here. That's the tartar buildup, and that bacteria actually eats away at the bone and creates the destruction and infection in your mouth.
So we have another question here that most people are interested in knowing about periodontal disease is, how do you know if you have early signs of periodontal disease, and what do you look for?
So that's a really good question. Periodontal disease is a silent disease, so many of the times you don't experience pain. A lot of people think, oh, I would feel pain and that's how I would know I would have it. But you can't necessarily usually, most of the time, feel any pain at all. You'll notice red, inflamed gums. They may be sensitive to flossing, maybe sensitive to brushing too, and they may bleed also. You'll a lot of times notice an odor coming from your mouth too and not know why. It's the bacteria that is creating that, and it's trapped under the gum tissue.
So people also want to know, what are the stages of periodontal disease? So can you answer that for us, Miss Sandy?
I sure can. There are 4 stages of periodontal disease. The first one is when you're in the gingivitis stage. So again, that is the reversible. We can fix that. Once you get into the second stage, which is mild periodontitis, that is where we will need to start treating. Here's a picture here of, if you can see that, of the mild and moderate periodontal disease. So that is where you've lost a little bit of bone here and the gums have resorbed up. And then the moderate, that's stage 3. Moderate periodontitis is where you've just lost a little bit more bone too. There might be some more tartar buildup under the gums might be more inflamed. You'll see the gum tissue actually pulled away from the tooth more. Stage 4, the last stage here, in advanced, if you can see that. Advanced is where the gums have resorbed up and you're seeing a lot more tooth exposure here. They look a lot of times like longer teeth, and that is because it's just broken down more bone and you've lost more attachment. Those are the 4 stages.
All right. Let's see, what's next? Who can treat periodontal disease? That's a good question.
Well, I can treat periodontal disease, but it is a partnership, so it would be me and the patient together. I'll be doing everything I can at our office, and the patient will be doing everything they can at home. So that is really important because we are a team, so you need to make sure you're good with your brushing, your flossing. You want to brush 2 minutes, 2 times a day, and you want to floss daily. Those are the really important things to make sure that you're controlling it at home as well, and I will do everything I can at the office.
Well, it's a good thing that I brush twice a day. All right. So what is the process for treating gingivitis and periodontal disease?
So treating gingivitis, first I'll start with that. So we are going to remove all of the plaque from the area and any of the calculus or tartar buildup that is there as well. Once that is done, just depending on the case, we may prescribe a specific mouthwash to help reduce the inflammation and help control the red, puffy, irritated gums. And we also may do a laser treatment or anything else needed to get the gums completely back to health. treating periodontal disease. We will do all that as well. We may set up different appointments just depending on severity, and we would do half of a mouth at a time, and we really want to take good measure and really watch over those cases to make sure that we are cleaning up all that bacteria and we're setting you up for success. We want to make sure we are doing a root planing procedure and scaling. So scaling, we're removing all that tartar buildup and all the plaque buildup in there, and then once that's done, we want to smooth the root surface. So we actually want to make sure that the root surface isn't as porous and isn't as rough. By smoothing the root surface, it's going to have a nice smooth area, so plaque won't get in those little grooves of the teeth as much. So it'll be easier to maintain it from there. So we also have something called Arrestin that we use, and that's an antibiotic that we put under your gum tissue. And what that does is it helps the reattachment of the tissues, the ligaments that help to hold your teeth in, and to kill off the bacteria in there. That's something we do in addition to our laser treatment for any of the gum tissue pockets that aren't responding to any of their treatment.
And lastly, how do I avoid getting periodontal disease, and what can I do at home?
So on my aspect, it's really important to make sure you come to see me or one of our other amazing hygienists who can take care of you and take care of that problem. By coming in regularly, we're able to go over flossing techniques or brushing techniques and make sure we're, more importantly, even scaling off all that stuff at home, because the more it sits there and more it's going to get inflamed and cause destruction in the bone and create that infection to be much bigger than what we could have controlled previously. So it's at home though, you can make sure you're doing really good with your brushing. 2 minutes, 2 times a day. I highly recommend an electric toothbrush. There are several studies that show that that is much more effective than using a regular manual toothbrush. So those things are really important, and you want to make sure you're flossing. Definitely want to be flossing, and you want to be doing a C shape, curving around each part of the gum tissue, each part of the tooth. That's really important. If you just go up and down, you're kind of sometimes shoving things up into your pockets deeper. So we don't want to do that. And those are the main things.
All right. Well, thank you so much,
You're
Sandy.
welcome.
So everyone, if you are interested in coming in and making an appointment with either Miss Sandy or one of our dentists here in the office here at Lakefront Family Dentistry, you can certainly give us a call during business hours at 951-244-9495, or you can log on to our website at lakefrontfamilydentistry.com and fill out one of our forms, and we will contact you and make an appointment with you. Thank you so much for watching today.
Thank you.